This week on Arizona Illustrated, a safe campus will require testing, treatment, and soon, tracing.
We all want to come back face to face, but we also appreciate the very real danger of this virus.
The keeper of schedules.
This is a lot to maintain and a lot of people to support, so I have to do it.
And how the Antarctic is helping Arizona keep its cool.
I had never seen wind like this, never seen waves like this. I was just blew my mind.
Welcome to Arizona Illustrated. I'm Tom McNamara. The AZPM crew and I are on the still largely vacant University of Arizona campus, but that could change very soon as fall semester begins August 24th with a mix of in-person and online classes. And with reopening just weeks away now, all eyes are on the state's response to the coronavirus. While Arizona's daily number of positive cases remains below its high of 4,877 on July 1st, the percentage of those testing positive also remains high, as about 1 in 5 tested are infected. And the timing is right for Arizona to roll out its tracing program, as only 3% of new COVID cases have been traced. For more coronavirus-related information and resources to help you and your family to stay safe, visit news.azpm.org. Each week, we are bringing you an excerpt from our weekly public affairs program, Arizona 360, which this week took a deep look into the University of Arizona's plans for reopening the campus. Lorraine Rivera spoke with former U.S. Surgeon General Richard Carmona, who is leading the plan.
The physical plant is ready to open, and that would include some of the modifications we've had to make in some of the buildings. For instance, we've created a dormitory, which is an infirmary. So should youngsters get sick on campus, they have a place to go where they can be quarantined so they don't spread the disease, but yet still take their classes in the rooms that they're in. We've had to look at other things too, the airflow, for instance. We're looking at outside locations to maybe have some classes because it's safer outdoors, but yet in Arizona, that's tough because it's hot. So possibly putting undercover tents with ventilation inside. And most importantly in the classrooms is decreasing the class size, making sure that there are appropriate barriers between the professors and the students, and that spacing is maintained, and ingress and egress in all classrooms and hallways are controlled.
Are shutdowns part of the inevitable should the worst happen? There was one university that said if there's a death, then we would have to shut down. Would that likely happen here?
Well, we're hoping it does not, but the president and I and our incident command team have discussed this frequently, that what would be the trigger points should we have to close. And those trigger points would be that the community gets saturated, that there's very few resources outside. And even if it appeared that the university was safer, we still couldn't chance it. We'd shut for that. If we started to see that there was any increase in disease within the campus, the threshold would be very low to shut the campus down and just go all digital. So we are hoping that through our education, through our inspiration, that people will adhere to these practices. But the president, in no uncertain terms, said, if we see there's a lack of conformity to what we say are the best practices, or there's an increase in disease on the campus, or if resources become strained in community, that's a signal that we would close down the university physically and move to a digital platform.
Infectious disease experts agree that to control the infection rate of coronavirus towards safely reopening schools, businesses, and a less restrictive daily life, we must test, trace, and treat. Testing to determine who might be ill. Treating those who are, that's easily imagined. But what about tracing, and how does it work? We approached those in charge of the U of A's tracing program in an effort to open up the campus to find out.
Whenever there's an infection running through society, the way that public health approaches containment of that infection is through testing for the infection, finding out who has it, tracing to find out who those infected individuals have been in contact with, and then isolating both the positively tested individuals and those that they've been in contact with, isolating them away from the rest of society. At the University of Arizona, we're calling this test, trace, and treat. We quickly had to develop the ability to test, and we are now working on the ability to trace as well as we need to so that we can isolate those parts of the population.
To talk a little bit more about the tracing efforts here, we actually are doing both manual contact tracing as well as we have a self-report. And then there is also a rollout of something that's very brand new and novel, which is this exposure notification system. And this is something that's completely privacy preserving. This uses the Google Apple API and is able to take what your phone puts out with Bluetooth. And then when somebody tests positive, that will then send a notification out to the people who were in relatively close proximity to allow them to begin quarantining and to prevent subsequent transmission.
We are the first state in the United States that has the entitlement from Google and Apple to the state so that we can get this working. So we're partnering with an app developer called COVID Watch, and they're the ones who are coding everything and developing the app. But what we're doing at the University of Arizona is we're telling them what we want that app to look like for the U of A. If a person has downloaded the app onto their phone will be issuing a random series of numbers. And if a person standing next to them has also downloaded the app onto their phone is also issuing a random series of numbers, and the phones are listening to each other. And so if one of those people then tests positive, an official health authority will send that person's phone a code. And that code simply says, this person has tested positive. The person has to actually put that code into the app. It's not automatic. And then we have all the information in the app telling them what to do. So all that downstream medical information will then be available to the individuals. We know that the more people that have this app, the better it will work. So we're trying to get as many people on campus as possible to download, activate the app, and then use the app and send out the notification when they get it, because it's going to really help us to be able to continue to be back face-to-face. And if everything works at the U of A and it's working as we expect it to, then we hope that the state of Arizona will then adopt it statewide.
The SAFER program stands for Student Aid for Field Epidemiology Response. We've been operational as a team for about 15 years, but we haven't ever had any scale of work like we've had now with the pandemic. We've had a surveillance laboratory on campus for many years, but it's relatively small. We have 4 phone lines and computers. So we have a virtual call center now that has been operational for about 3 months.
Did you attend any gatherings with more than 10 people?
In our physical space, we could really only have 4 students in there at a time. And now we can have 400 students in there at a time. By doing it in Zoom and having a supervisor there, it helps people feel a little bit more comfortable with knowing that they have support while they're doing that. When somebody does get sick, what happens is that we get their contact information. So we get their name and their phone number from the county health department who has received it from their lab report. Then the next step after that is to determine who has been in contact with that person, kind of what the duration of that contact is, the distance for that contact.
Lost my sense of smell and taste.
Once somebody has been identified as a contact, we follow up with them, just a short survey. Again, most of this is online. People can do it on their phone. From there, we will call the person who has been exposed.
A public health team member will also reach out to them and notify them that they were exposed, but we will not mention your name when we do so.
My students who are in the SAFER course got pulled into this very quickly, and all of them have just really done an amazing job.
But before we move on, do you have anything else you'd like to add about your illness?
One of the challenges with public health is to make sure that we're reaching the widest audience that we possibly can. And we know that we're never going to get 100% of the people 100% of the time. But for every additional person that we can get, that's additional people that they don't end up affecting, and then people that they don't end up infecting, right? So if you can stop that train of transmission early, that's really has a larger impact on the community as a whole.
Safety is not dichotomous. It's safe, it's not safe. It's a spectrum of sort of really dangerous to safer. What we can do is minimize the risk as much as possible. And I think with all of the efforts that are going on, we are making as good an attempt as possible to do that. As an epidemiologist, I'm excited to see all of the innovative and creative strategies that we're implementing here. But I still have reservation. I think we want to make sure that people feel the urgency and the importance of this and really buy in order to have this be the most effective strategy possible.
Everybody who works at a university loves working at a university because we get to interact with so many fantastic people. That's one of the great things about being at a place like this. And so we all want to come back face to face, but we also appreciate the very real danger of this virus. The more people we can get to follow these protocols and mitigate their exposure to the virus, the greater chance we all have of coming back and doing everything that we do at the university.
The COVID Watch app isn't available for download quite yet. Keep your eye on the Apple and Google app stores, as it should be soon. While women have slowly made economic and professional gains over the last half-century, the pandemic is revealing and exacerbating gender inequality in alarming ways, at work and at home.
COVID-19 will have a disproportionate effect on women.
Well, my anxiety is that we're already living in the fallout. That's what got us here. That's why we're here.
I do try to keep such a handle on myself and on this household because this is all we have.
New evidence is showing the inequalities that women have endured and in many ways overcome are now resurfacing globally and intensifying.
It was not until 1920 that women in all states of the Union could vote.
Women have always only made a lot less than men, about 81 cents on the dollar right now. But with COVID, we're seeing a disproportionate number of women being furloughed off of their jobs, and so pushing them more into poverty. So in my own profession as a professor, we've seen over the last few months a reduction in the number of journal articles submitted by women. And partly this is due to extra responsibilities that they've had to take on during COVID-19. So career advancement gets affected as well as kind of current job duties and job pay.
It's so internalized, because there's nobody to talk to. It's I have to work.
Kiani Adams is a radiographer, a single mother of 5 children, and cares for her mother who struggles with health issues.
This is a lot to maintain and a lot of people to support, so I have to do it. So even in those days when I wake up and I'm shaky and I'm nervous and I'm just get dressed and you go to work and you do your shift, and I'm sitting at my desk, having a panic attack.
You think in micro movements now, you think everything is a risk.
Sarah Hubbs is an artist and mother. She now cares for her 8-year-old daughter full-time while her husband works as an emergency room physician. Like many women, Sarah has seen major setbacks to her career advancement due to taking on the bulk of responsibilities in the home.
There's this layer of worry on everything, and I think in the back of my mind, that worry is there with me every day about how to keep my family safe and healthy.
Well, just look it up and see if it's on another one, Ren.
We have all these extras around us. Okay, today for homeschooling, we are walking through our neighborhood, making sure your kid gets on the Zoom calls, making sure they're doing their work. Getting her to the doctors or being in charge of the social life. Like, when your kid goes to play with someone, arranging that, or when they see their grandparents. And for me, it's both sides of grandparents. I'm in charge of getting her to see them.
In terms of the labor with children, we also look at emotional labor, keeping of schedules, of knowing which stuffed animal is going to provide comfort, or what is the neighbor child's phone number so that their daughter or son can interact on the phone in some kind of social way. So women pick up that emotional labor. It's what we call the third shift. And that has increased, of course, tremendously with kind of the anxiety and nervousness that kids feel during this COVID-19 time.
I really don't talk about it with them because I don't want them to freak out and get scared. I don't want them to be worried about me because I'm gone every day. So it's almost like I'll ask them, so what do you think? Do you feel safe? Do you think, what do you think about the virus? Do you have any concerns? Like, I've asked all of them and they're just like, no, we're fine. But I think that's because I don't say anything. Like with my mom, and as scared as she is, it's like something we don't talk about the fear aspect of it. That's what I think. But I definitely have a hell of a lot of anxiety.
The people that I talk to right now, the people I'm leaning on, the people who lean on me are mothers. Because we've already been doing this. We've already been connecting and helping each other for a long time. I was on a phone call with some of my friends. There were 7 of us, and 5 out of the 7 are doing this alone.
I do worry that some of the gains that we've made in terms of our wages and our kind of our legal access to different things will kind of be retracted again.
To have everything fall apart during a pandemic, like, are you serious? Like, even if there wasn't a pandemic going on, it's hard. We've been homeless before. I've been jobless before. Like, that is like the scariest, things that can happen. And now it's like we're facing that again with this pandemic. Like, if I lose my job, I'm sure I could find another job, but is it going to support us? Am I going to have to get back on state assistance or unemployment or whatever? Like, I don't want to go back to that.
Coronavirus is just shedding this giant magnifying glass on all of this. Many of us have been saying, sounding the alarms for a while now on so many different issues within our world, and this is just picking at all of our weaknesses that we've been ignoring for so long.
As women are overrepresented in service industries, informal economies, and in healthcare sectors, it puts them at extra risk of contracting COVID-19. Women of color are even more disproportionately affected, with higher levels of unemployment and less access to quality healthcare. Within Black communities, anxiety is further induced through racial tensions that are gripping the nation.
We have to realize that not all women are equal. Women of color tend to have less health insurance, and they also have more pre-existing conditions. So in terms of the health sphere, we see like disproportionate in terms of women, but also women of color.
Like, we haven't been talking about it. Like, but that's the choice. Like, as a white person, you don't have to care. You don't have to understand that, like, that's the plight of people of color. That's not, we don't care about, there's a ton of Black men and women in prisons, just don't have access to good health care or, really good education. Like, you can hear about it in the news and go, oh, that's too bad. That's not us. Like, it's just something that no one's ever had to care.
As a parent, especially a parent of a daughter of color too, I just keep thinking like, oh my God, we just have to get women, mothers, women of color into these positions of power. Like, that's, to me, the fundamental thing that has to change.
Because it's not just us, you know what I mean? That's what I have to kind of like bring it down sometimes, because it's like there's 7 billion of us. That's a lot of people. And how do you end the suffering and all the issues of 7 billion people so that we're all like, everybody has clean water, everybody has food, everybody has access to education. I'm talking everybody.
Women are resilient, and we've been on the front lines of a number of things. We have really fought to get the right to vote. We have fought hard for equal wages. We're not there yet, but we've made huge inroads in progress. We're very resilient. We're very compassionate.
This year marks the 100th anniversary of women winning the right to vote in this country.
And so my hope moving forward as we move through COVID-19 is that we can use our resilience and our strength to move women again in positive direction.
In Tucson, climate change isn't a theoretical concept. From longer, hotter summers, dropping levels on Lake Mead, to wildfires burning in our mountains, the effects of climate change are all around us. University of Arizona professor Joellen Russell makes predictions about how our climate could look in the future. And she gets her answers from a body of water far away. This is an Arizona oceanographer.
1 out of 8 carbon molecules that come out of anybody's tailpipe anywhere in the world, yours, mine, the governor's, 1 out of 8 is going into the ocean around Antarctica within a year. So everybody says, well, why study the Antarctic when we live in Arizona? I'm like, well, why do you rob banks? Because that's where the money is. That's where the carbon and the heat are. So the ocean's doing us a favor, a huge favor. And how much it's able to take up over what time period, how much of the carbon, how much of the heat, will determine what happens to our desert home. I'm Joellen Russell. I'm a professor here at the University of Arizona in geosciences, hydrology and atmospheric sciences, planetary science, and applied math. I'm in an interdisciplinary kind of science. I'm an Earth system modeler and oceanographer, and we're working on trying to figure out what's going to happen next. I grew up in an Eskimo fishing village called Kotzebue, 31 miles above the Arctic Circle on the Arctic Ocean, or the Chukchi Sea. As a small child, watching everybody hunt and fish out on the ice and in the canoes and the kayaks, it was dangerous and it was scary and it was amazing, where the weather and the ice and the animals and the people, we had to watch, you had to be careful, you had to know things about how it all worked. And every year the sea ice would go out and I would wonder, where did it go? Because you couldn't follow, it's too dangerous, right? You get crushed, your boat could get crushed between ice floes, etc. So I grew up at wanting to be an oceanographer since I was 12, and I wrote scripts or bust on my sneakers when I was little. You know, my Chucks, I had them all decorated, scripts or bust. And when I got to scripts, I said, I want to go to sea. I want to see what that ocean, the other one, I know what a blizzard feels like. I grew up on the tundra, I know. I want to go see what this one is. And when I got there, I had never seen wind like this, never seen waves like this. I was just blew my mind. And that was it. I have been obsessed with the ocean around Antarctica ever since. So the Southern Ocean is the ocean around Antarctica. This ocean is really special because it has the world's largest current. This current, called the Antarctic Circumpolar Current, it carries 4 times as much water as the next biggest current. Most of the heat that's going into the ocean is going in around Antarctica, about 78 to 95%. Because of that massive current, you've got mixing along inside the current, and it's going very deep, and it's taking some of that heat and that carbon with it. That is critical to humans and our happiness and the length of cabin fever time in Arizona. Each of these little dots and the little squiggly spaghetti trail behind it is a robot float that we deployed as part of our Southern Ocean Carbon and Climate Observations and Modeling Program. We have 200 of these floats out, and their little antenna, they beam their data back by Iridium satellite, and we put it online for the entire world to see, as well as us to crunch, within 2 hours of it coming through. If you want a good prediction about what's going to happen here in Arizona, it's not just predicting what happens to just the atmosphere, just the ocean, just the land surface, but all of them together. There are other things too, like what we emit into the atmosphere, this growth in CO2 that's making us so much warmer. Every 10 years, the Weather Service updates our climatology. What they say is every 10 years, we get hotter and drier. So these are important things, not just for ranchers and farmers, but for moms like me who are like, so cabin fever, when is this going to end? I mean, boy, we got hot early this year, and who knows how long it's going to last into the fall. I mean, we're all hoping that we're not, grilling our turkeys outdoors because it's Thanksgiving and we're still roasting. All of our predictions about what might happen next include this increasing CO2, right? Some of them flatten it out after, 20 or 30 years where they say, okay, there's one scenario where it all kind of comes down because we all work at it and we bend the curve and we do this together. And some of them say we burn it all and it keeps going up, right? And that's the scary one, where it gets extraordinarily hot here, our summer lengthens and lengthens and lengthens. So the trick is with this is it's been increasing like this, and then COVID hit and boop, we had an abrupt drop. That drop has never happened. We have never seen anything like this. Now, with this little bloop, we still have a huge amount of CO2 in the atmosphere, so that's still there, still working. But we have to find out if our models can even handle a quick drop, because we didn't even consider it. And I'm hoping that individually as well as collectively, we basically make choices about what CO2 we feel is valuable enough to put back in the atmosphere, right? We didn't do it during the pandemic. If it's really needed, we should do it. But if it isn't, or if we can find another way to do it, what an incredible example of how we could actually start the downward trend. This is what we do. But please don't think that because we study the icy deep black abyss that we aren't thinking every day about our friends and family in Tucson. Of course we are. We study this because we want to know for them what's going to happen next.
Before we go, here's a sneak peek at a story we are bringing you soon.
Japanese bombers hit the Arizona 4 times with their bombs.
And one of the bombs hit the number 2 turret, which is under my feet and about 20 feet ahead of it.
That 1,700-pound bomb glanced off the turret and dove 3 decks below, into the forward powder magazine on the starboard side of the ship.
Which, unfortunately, was where my buddy, Billy Mann, that was his station.
Thank you for joining us here on Arizona Illustrated. I'm Tom McNamara. Stay safe, and we'll see you next week.